Well, let's start with the latest health updates coming from India. Now, Gujarat remains on high alert as Chandipura virus cases rise. State Health Minister Praful Pancheriya said that 35 of the 184 suspected cases have tested positive for the infection. All the affected patients are below 15 years of age. Now, the state has reported 22 deaths linked to the outbreak so far. And the Health Ministry, Health Department, it has intensified surveillance and testing efforts across affected areas and is working to identify and isolate suspected cases.
Super specialist doctors and our health team conduct tests in all areas where patients are found and also test others and family members. However, no patient has been found in the same area yet. Therefore, finding and researching the case has become very difficult.
According to the World Health Organization, Chandipura virus is a member of the Rhabdoviridae family and is known to cause sporadic cases and outbreaks of acute encephalitis syndrome, which is a serious condition that leads to inflammation of the brain. It was first identified in 1965 in Chandipura village in Maharashtra, India, from which it gets its name. Now, the virus is transmitted by vectors such as sandflies, mosquitoes and ticks. Symptoms usually appear suddenly and may become severe within a short period. Common symptoms include high fever, severe headache, vomiting, weakness and fatigue, muscle pain, irritability or unusual drowsiness, convulsions or seizures, loss of confusion in severe cases as well. Now, there is currently no specific antiviral medicine or vaccine available as far as treatment is concerned. Now, the treatment mainly focuses on supportive care to manage symptoms and prevent complications. And for more on this, we are now being joined live by Dr. Sanjeev Bagai. He is a pediatrician and pediatric nephrologist and chairman and managing director of Nephron Healthcare. Dr. Bagai, thank you for joining me on the broadcast today. This Chandipura encephalitis virus, it's known to progress alarmingly fast, often deteriorating within 24 to 48 hours. Now, what actually happens inside a child's body once it is affected, and why are children under 15 most vulnerable to this?
Good afternoon. So this is a RNA virus. It's a single-stranded RNA virus. This spreads very rapidly. It has a very short incubation period of just a couple of days. And it has a unique ability to evade the immune system of the body and enter into the cerebrospinal fluid. That's the fluid which is in your spinal cord, and it circulates all over, covering your brain. And it sets across a cascade of inflammation, which includes a lot of inflammatory markers, which not only kill the cells in the brain, but also form infarcts. That means a child can bleed inside the brain or lose oxygen supply to certain parts of the brain. It is specifically under the age group of 15 because it is transmitted through what we call as sandflies, which is your primary vector, and your secondary vector is ticks and mosquitoes. So exposed parts of the body in children when they play in the ground or in the park, especially near livestock, this is why children get affected much more. It presents just with high-grade fever, very common in monsoons, relatively high humidity, moderate temperatures in the environment, and a child can come with high-grade fever, sudden onset, headache, vomiting, loss of consciousness, altered sensorium, convulsions, and very quickly and rapidly slip into multi-organ failure. There is no vaccine, there is no FDA-approved antiviral so far for this virus. We can detect it through a PCR test, but apart from giving supportive therapy, not much can be done. Worldwide, this is rare. It's been first isolated in 1965, but just a handful of 100 cases worldwide. So still it's tough going. 75% case fatality is a high number to lose. So it is a acute encephalitis virus. It affects the brain. So precautions are what we must focus on.
Okay. Dr. Bagay, you've already highlighted some of the symptoms, right? But during the monsoon season, some of these symptoms can often be mistaken for routine viral fevers or dengue. Any specific red flags that parents must identify in order to, trigger and rush the child to the ICU instead of just waiting at home for it to recede?
Yeah, so most of the viruses in the first 24, 48 hours appear exactly the same, be it malaria, dengue, chikungunya, Zika, or indeed this rare virus which is called as Chandipura virus. But any child which has altered sensorium with acute onset high-grade fever, any child presenting with sudden pulsating headache or nausea, vomiting, altered sensorium, then we must keep this in mind, especially if you are in the endemic area, which is of Gujarat and Maharashtra, in those belts. A test is available. Supportive care must be started immediately. There is a lot of fluid loss which takes place in the intravascular compartment. That means a child can slip into hypotension and shock very quickly. So supportive care is what is important. Long-term deficits happen in about 20 to 30% of children with hemiplegia. That means you could lose half your body function even if a child survives this virus. So a high index of suspicion is important.
Okay. Dr. Bagay, like you were highlighting, given that currently the cases are mostly scattered in and around Gujarat in several districts, how do we prevent it from further spreading, instead of a single cluster? How difficult it is for the vector control, and could semi-urban or urban areas in other parts of the country also be at risk? How fast can it spread, and should other parts of the country be concerned at this point in time?
That's an interesting question because it's primarily detected in the cerebrospinal fluid through what we call as RT-PCR. But having said that, it has also been isolated in saliva. Although no human-to-human transmission, especially through aerosol, microaerosol has been documented. So by coughing, sneezing, touching, or sitting in groups or clusters, this virus it doesn't spread. So which is a good thing. But what we need to focus on is on civic hygiene, on preventing waterlogging, making sure the mud walls, especially in rural India, because that's where the sandfly breeds. The cracks in the mud walls must be covered. To stop littering, open garbage. These are all focal points where sandflies, mosquitoes, and ticks can breed. And apart from that is regular fumigation, vector control from the local municipalities. It's important, but more important than that is to cover the exposed parts of the body, especially in children. That means arms and legs must be covered to prevent these bites.
Right. Some of it you've already highlighted, Dr. Bagay. Now, beyond government pesticide spraying and sealing mud cracks, any other practical steps, some of which you've already highlighted, can families in rural communities take right now to protect children from these sandfly bites?
It's the local environment which we need to keep clean. Stop waterlogging, prevent waterlogging, that is, even within the house to keep it in open utensils or coolers. A lot of people still use coolers. So stagnation of water in coolers, these are breeding grounds of insects and mosquitoes and sandflies. So we need to be educating the public at large on that. And no self-medication. The worst thing which families can do is to begin a course of antibiotics or random fever medicines or painkillers, which can in fact worsen the condition because the child as it is going to have a lot of GI symptoms of vomiting, abdominal pain, cramps, and nausea, and including of fever and headache. So it's better to take advice from doctors as quickly as possible. But public awareness is important. Public messaging is important.
Right. Doctor, apart from that, like you highlighted, there's no antiviral drug at this point or a particular treatment for a vaccine for treatment. But supportive care, that's the only measure that one can take at this point in time. What does ICU supportive care actually look like in practice? If you could just help our viewers understand that. And how effective is early oxygen and ventilator support in preventing multi-organ failure?
So when you look at a child who is unwell or is sick, we look at the what we call as the hemodynamic status of a child. That means the three cardinal principles are A, B, and C. A means airway, B means breathing, C means circulation. So in layman language, we have to ensure that the child is able to breathe, the airway is clear. In case a child has labored breathing or carbon dioxide retention, to ventilate the child early and not late through a mechanical ventilator, to make sure that the breathing and the oxygenation is adequate, to check through a pulse oximeter, to check there is no acidosis. That means the lactate levels. These are all markers to show that the circulation is being compromised, to check on that, and to make sure that the child's blood pressure is maintained. So these children very often require IV fluids for 2 or 3 reasons. One is they lose a lot of fluid because of the infection. High-grade fever makes you lose more fluid. In hot, humid conditions, you lose another lot of fluid. And the child being unconscious or vomiting is not able to retain much orally, or the appetite goes down. So IV fluids becomes an essential part. To correct the electrolytes becomes essential.
All right. Thank you so much, Dr. Bagai, for sharing all of those insights and especially highlighting ABC in order to prevent the spread of the virus. Thank you so much for joining me on the broadcast today.